HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system. Your immune system protects you from illnesses. HIV weakens the immune system, making it harder for your body to fight off infections. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the most advanced stage of HIV infection. It happens when the immune system is severely damaged. HIV attacks specific cells in the immune system called CD4 cells. These cells are crucial for fighting off infections. Over time, HIV destroys these cells. This makes the body vulnerable to a wide range of illnesses. It's important to remember that having HIV is not the same as having AIDS. With proper treatment, people can live long and healthy lives with HIV. Early detection and treatment are key. HIV transmission occurs when infected bodily fluids enter another person's bloodstream. In Nigeria, there are several common ways this happens. Unprotected sex is a major mode of transmission. This includes vaginal, anal, and oral sex without a condom. Condoms act as a barrier, preventing the exchange of bodily fluids. Sharing needles or syringes is another way HIV spreads. This is particularly risky among people who inject drugs. When needles are shared, infected blood can directly enter another person's bloodstream. Mother-to-child transmission, also known as vertical transmission, can occur during pregnancy, childbirth, or breastfeeding. HIV-positive mothers can pass the virus to their babies. However, with proper medical care, this risk can be significantly reduced. It's important to note that HIV cannot be spread through casual contact like hugging, shaking hands, or sharing utensils. It's crucial to dispel myths and misinformation surrounding HIV transmission. HIV attacks the body's immune system, specifically targeting CD4 cells. These cells are vital for a healthy immune response. As HIV multiplies, it destroys CD4 cells, weakening the body's defenses. The progression from HIV to AIDS happens in stages. Initially, a person may experience flu-like symptoms. This is known as the acute HIV infection stage. As the virus multiplies, it gradually weakens the immune system. Over time, the decline in CD4 cells makes the body susceptible to opportunistic infections. These infections are usually harmless in people with healthy immune systems. However, in people with weakened immune systems, they can be life-threatening. It is important to remember that everyone's experience with HIV is unique. The progression of the virus can vary greatly from person to person. Regular medical care and monitoring are essential. Section 4. Recognizing the symptoms and getting tested. Early HIV infection may not always present noticeable symptoms. Some people may experience flu-like symptoms such as fever, headache, sore throat, and muscle aches. These symptoms can last for a few days or weeks. The only way to know for sure if you have HIV is to get tested. HIV testing is readily available and confidential. Testing involves a simple blood test. Early diagnosis and treatment are vital for managing HIV. Section 5. Living with HIV, the role of antiretroviral therapy. While there's no cure for HIV, antiretroviral therapy, or ART, has revolutionized HIV management. ART involves taking a combination of medications daily to suppress the virus. These medications prevent HIV from replicating, allowing the immune system to recover. ART effectively reduces the amount of HIV in the body, known as the viral load. When taken consistently and correctly, ART can suppress the viral load to undetectable levels. This means the virus is effectively controlled and the risk of transmission is significantly reduced. Adhering to ART is crucial for its success. It's essential to take medications as prescribed and to consult a healthcare professional if any side effects occur. ART is a lifelong commitment that requires ongoing medical care and support. Living with HIV requires adaptation and ongoing support. Support groups, counseling, and access to healthcare professionals specializing in HIV care are invaluable resources for people living with HIV. Section 6. Nurses' pillars of support in HIV/AIDS care. Nurses play a pivotal role in HIV/AIDS care. They provide education, counseling, and support to people living with HIV and their families. Nurses are at the forefront of prevention, promoting safe sex practices, and providing testing. In clinical settings, they administer medications and monitor health. They offer a compassionate space for patients to discuss concerns. Nurses advocate for policies supporting people with HIV. They work to reduce stigma and ensure access to quality health care. Their dedication improves the lives of people living with HIV. Nurses are essential, providing holistic care and empowerment. If you have concerns about HIV, get tested and seek advice.